All right, we're live. Good morning. This morning's discussion will focus on the dog. So anything from this Seinfeld episode anybody found interesting?
I find it notable, George and Elaine dynamic, when Gary wasn't present, just how awkward and comfortable it was, and the concept of triangulation came up, because the only thing we had in common was to basically make fun of Gary when he wasn't there.
Yep. Just for those that don't understand the term borrowed from family therapy or family dynamics, what is triangulation?
It's basically in the family system, the parent and child will basically team up against the other parent, with some outcome.
Mhm.
Um,
And it's usually to maintain the relationship, right, or to strengthen it. And that's clearly what is going on here. And this brings to light a couple things, I think. Number one is that there might be some friction, conflict between Elaine and George, and I don't think anyone would disagree whether this episode or even previous episodes. And that's something that might come to clinical attention. And I mean, not that well, I'm sure it has in some selected episodes of the syndicated series, but that's something to keep in the back of everybody's mind. Hypothetically, if there were no such person as Jerry Seinfeld, the character, do you think that Elaine and George would be friends? Clearly not, right? So they're coexisting because of Jerry. You mentioned the word parent, which is interesting because Jerry is anything but a mature parent-like figure. And Elaine herself has brought it up on several occasions as well, and so has George. So significant, I think, interpersonal dynamic, and yes, triangulation here. These two have absolutely nothing in common. Matter of fact, there's more than one episode, I think, where George doesn't use the word dislike, but almost feels intimidated by Elaine. Right? Any other thoughts or observations about the relationship between George and Elaine, generally speaking, or illustrated, demonstrated in the dog? How about specifically focus on any of these characters or either of these two characters? Anything George said, Elaine does that warrants further discussion or through a psychiatrist lens.
I guess for Ian, at least, she really wanted to discuss why the relationship was awkward, so she tried to meet with him again and discuss why, whereas George was more avoidant, I think, not wanting to discuss. Just kind of trying to avoid the situation altogether.
Yeah, and I think that that probably links to their independent level or respective level of dependency or dependence on Jerry. I think Elaine at least comes off as being more autonomous and therefore feels that comfort level in exploring the why. And I don't think anybody here, just as your second week discussing Seinfeld from a clinical perspective, would be surprised as to why George reacts the way he does. I want to use your observation to kind of open the door to another discussion, which may or may not actually fold back to either of these two characters, and that's avoidance. And so to start out, I think everybody needs to appreciate that this avoidance is a defense mechanism, all right? And then we're going to kind of take the conversation from there. But before we do, what is the general definition of a defense mechanism? What are these processes?
These are ways where someone deals with it's a Freudian concept where people handle, I guess, stress or anxiety in ways that are adaptive or maladaptive.
Mhm.
There are very few adaptive ways, and suppression would be one that's adaptive, whereas there are at least 17 nuances that are
You
considered
counted?
a lot. There's like 3 adaptive, and there's like a lot of maladaptive ways that people kind of deal with stress or anxiety or difficult situations, and avoidance is a maladaptive way of handling a stressful situation, I guess.
In a general sense, yeah. And I do want to talk a little bit about what you had gone back to on two occasions. And that is the general idea of anxiety, right? So the situation is when you want to do something but feel that you can't or shouldn't. That desire, that impulse is warehoused in your id, that's your unconscious, that primarily is biological drives. The superego develops to make sure that the id is kept in check. And when that happens, the individual, usually the toddler, will always be in conflict, right? What you want to do versus what you feel that you can or should do. This conflict results in anxiety, and that anxiety is mediated by the third and final component of your unconscious topography, and that is the ego. And the way the ego does this is through those ego defense mechanisms, and there's about 17 of them, I guess. Avoidance being one of them. From there, avoidance can actually be the nidus to develop other mental disorders if maladaptive, right? And if rigid, if you can't switch off of avoidance and use multiple defense mechanisms throughout your day. And in the most severe cases or in the most critical of cases, the individual might be at risk to develop the anxiety disorders or one of the anxiety disorders. For shelf-related purposes, know that avoidance is likely to appear on your test, and it is likely to be the first, perhaps second sentence on your test, on your shelf exam, for which A, B, C, and D will be difficult to differentiate. What will differentiate the single best answer will be the rest of that paragraph and what the avoidance or the other signs and symptoms that are co-occurring with the avoidance. So be very careful, no matter how the first sentence sounds, no matter how your patient looks after reading that initial sentence, read the question thoroughly. If you want to take a peek at the answer set to get an idea of what therefore you should be looking for in the rest of that clinical vignette, do so. All right. For the individual who is avoiding, as manifest by behavioral symptoms at the age of 18 months, what is likely going to be the single best answer? And the hint here is that this is a trick question. 18-month-old who is demonstrating anxiety upon separating, usually from the mother figure or a parental figure.
Progression.
Louder?
Mm.
Right. Separation anxiety peaks at 18 months. It is normal. Now, the same exact scenario in a 9-year-old is likely.
Separation anxiety disorder.
Right. We're going to use the D word, disorder, there because it's age inappropriate. Right. So that's just a subtle reminder that if you look at that answer set, it may cue you into what you should be looking for specifically. In this case, it's whether or not that anxiety, as manifest through behavioral symptoms, is developmentally appropriate or not. Right? Much more to talk about, a little bit beyond the scope of the 10 minutes or so that we have left here, but wanted to make sure I began to cover that topic. Back to Seinfeld, back to the dog. What else did you say?
Well, Barthel's owner, this is someone who may have a substance use issue, but when we're talking psychological, I guess, he's saying that this dog has this breed that is better than Jerry and whoever's around him, but had left the dog, was released from the hospital and hadn't come to get his dog that he loves so much. So that was interesting. It was interesting that there was a conflict with what he was saying about the dog, yet his actions were completely different.
Yeah, I think there's a couple of things to look at here, and that is the illness of alcohol use disorder, as well as, and we could talk a little bit about intoxication as well as withdrawal and perhaps even the treatment for withdrawal, but also the treatment for alcohol use disorder as well. And I'm gonna actually start with that because I think what you identified as a observable behavior, something that we should discuss, and that is often we will discuss with patients the biopsychosocial resources that are available in your medical recommendation as to what a treatment plan should consist of in addressing their alcohol use disorder. And very often you'll get feedback, which amounts to the answer being no. And that often entails the timing not being right. I have rent to pay in a week. I have something to do tomorrow. I have a birthday or obligation coming up, etc. One of the things that you could borrow from Alcoholics Anonymous or AA is the adage that anything you put in front of your sobriety or before your sobriety, you're likely to lose anyway. Right, so we see that here. We see that here. We see him intoxicated throughout the entire 30 minutes. And the idea that he's in the care of or custody of a dog is, it complicates, albeit I think in a comedic way, what he is trying to accomplish. Right, so anything you put before your sobriety, you're likely to lose anyway. Right, so just keep that in mind when addressed. Now, you're not going to be confrontative with the patient when they actually give you why. You'll identify that they're at the pre-contemplative stage, and what's the defense mechanism you're likely employing at pre-contemplation when it comes to the stages of change? Denial. Yeah, so previous discussion, Freudian defense mechanisms matches up now with the theory from Procasta. On those stages of change, denial is that pre-contemplation stage. All right, so before you can actually even get to that conversation, you have to address his intoxication. Not much to do here. Provide him a safe environment, comfortable, be prepared, be proactive when it comes to alcohol withdrawal, because if he is going to decrease the amount, whether it's because he was admitted or outside the hospital, it's something that the clinician has to be proactive about. I think on a shelf exam, you're probably not going to really have to worry about identifying alcohol intoxication as a single best answer. I think everybody can readily, identify that. One of the things that often comes up on exams, though, is related signs and symptoms, and if observed, and there's two that usually come off in standardized exams, the type of alcohol that is being abused. So any pairing or any ideas as to what you might expect to see on a shelf exam related to the type of alcohol and what signs and symptoms might manifest? So ethylene glycol. What are you going to see on that exam?
Some
Is it stones?
percent.
Yeah, you're gonna get right. You guys are making me go back 30 years to remember this, all right? And then how about methanol? Hmm? Yeah, right. So eye findings with methanol, it's toxic to the optic disc. The crystals in the urine or in the urine sample of somebody with ethylene glycol intoxication or poisoning, right? Those come up a lot in exams. All right, alcohol withdrawal. Complicated withdrawal states versus uncomplicated. Give me 2 or 3 factors or signs that would allow you to say it is a severe or complicated withdrawal state. Psychosis and seizures. Okay, psychosis has 2 varieties, which may appear on the exam, may not, because in 2013 I think the APA tried to simplify this. Alcohol-induced psychotic disorder is a more general term now, but I think on shelf exams you might actually see the 2 subtypes or variations of psychosis in the context of alcohol withdrawal. What are they?
Or
They're more syndromes. So if your patient is hallucinating, if they're telling you that there are spiders, snakes coming out of the wall, what's your differential? And you'd be right to say alcohol-induced psychotic disorder. That's the 2025 lumping term. It could be. Let's hold on to that one though. Right? What if they're also confused, and you were and I would be, you're going to be consulted for agitation. Yeah. Right. The condition formerly known as delirium tremens or DTs, alcohol withdrawal delirium. A person's delirious, they're confused, right? Cognitive deficits that are acute and onset, right? Alcohol withdrawal delirium. However, what if they continue to tell you that snakes are coming out of that wall? However, they are not delirious. Yeah. Alcoholic hallucinosis, again, in 2025, alcohol induced psychotic disorder. Those 2 terms are interchangeable, right? The treatment is going to be the same treatment for alcohol withdrawal, but now with Haldol as needed. or an antipsychotic as needed. Any other thoughts or any other questions pertaining to alcohol withdrawal in general? All right, we'll leave it here. And for those watching back at home, we're going to jump right on our link for morning rounds. See you there.